Okay.
Thank you. Hello, fellow Toastmasters. Thank you for having me here today. Do you know that in some European cultures, it is very rude to ask someone that you just met what they do for a living? I want to move to Europe so that I can just avoid that question. So, what do you do for a living? Do you know that most people don't really care what you really do for a living? Sometimes people have asked that question because they want to know, they're trying to gauge how much money you make or how educated you are. But most of the time, it's just a filler question. Nobody really cares about the answer. Now, why does that question really bother me? Well, what I do for a living, at this point you're probably thinking, Tanya must be doing something horrible, something disgusting, somewhat illegal or immoral. Gordon, I hate to disappoint you, but I'm not a pole dancer or a stripper. I don't sell drugs. I'm not a murderer for hire. I'm not an exterminator of wild animals. I am not a sewer cleaner. And I do not work at the Fukushima power plant in Japan. So all those things are off the table. But my profession is a little bit difficult to explain. To this date, my parents really don't know what I do. My kids and my friends have some vague idea of what I do, but they don't really understand it. So I figured in Toastmasters, eventually people are going to come and say, so, what do you do for a living? And I figured I will answer that question once and for all. We'll get it out of the way. Everybody will know, hopefully understand what I do, and then we can move on to other topics of conversation. So, some of you have pretty easy professions to talk about. Jen is a teacher, Anita is a therapist, Cole is an accountant. So we all have a pretty good idea what these individuals do day in, day out as part of their job. Do you want to know what I do for a living?
Yes.
Yes. Okay. So I am an account manager for a company called MSD, Mesoscale Discovery. And what I do is I sell biomarker immunoassays on an electrochemiluminescence technology platform to preclinical and clinical research organizations in academia, biotech, and pharmaceutical industries.
What?
Got it? Right? Okay. Thanks, guys. Did you want to hear more? Did you want to understand what this is about?
Drug dealer.
Basically.
That's true. So now that I told you what I do, I need to explain a little bit more what this really all means. Before I explain what I personally do, I need to explain a term to you, the term biomarker. This is something you're probably going to be hearing more and more because this is the hottest thing in medicine today, and it's going to continue on being hot. Have you, any of you had a blood test recently? Mm-hmm. Yes? You've had things checked like your cholesterol level, glucose, or your chloride. Well, these are biomarkers. A biomarker, by definition, is any biologic that actually is an indicator of a disease state, or a physiological process. So for example, at this point in time, we all know that cholesterol, a high cholesterol, is an indication of, is a predictive biomarker of incoming heart disease. So if you have high cholesterol levels, there's a likely chance you're going to develop heart disease as you age. So that, I think, is pretty clear in today's population. Now, besides cholesterol, there's thousands of other biomarkers that scientists are they're working on and identifying today. Let's talk about something that you may not be familiar with. Do you know that the only way today to correctly diagnose Alzheimer's is through an autopsy? Okay? So it's good to know what disease you're suffering from, but it really doesn't help you find out what the disease was after you die, right? That's not very helpful. So what scientists have done, they've done autopsies and they've dissected the brains of normal humans versus people that seem to have Alzheimer's, and they found out that in Alzheimer's brain there's things that are called a beta 42 plaques and protein total tau tangles. So tau and a beta 42 are probably going to be the two biomarkers that we're going to be using down the road to determine if you're going to be coming down with Alzheimer's. So in your 40s, when you're having a cholesterol check, you're probably going to have some sort of a test done to see if you're likely to develop Alzheimer's. So today's market, pharmaceutical companies are going crazy about AD or Alzheimer's disease because they're hoping that they're going to come up with a pill And you're going to start taking in your 40s, and you're going to take it for the next 40 or 50 years so you don't get Alzheimer's. So it's going to be a huge market, like a cholesterol market. So now we talked about all these biomarkers. We talked about cholesterol. We talked about Alzheimer's. What do I do? You still don't know, right? Well, this is the world I live in. I work with biomedical research institutions, people that are working on biomarkers, identifying the biomarkers and also being able to measure it. My company makes tests, or what we call assays, or immunoassays. It's not important what technology and things we use at this point, but those assays are a way of determining what the biomarker is, measuring it, and quantifying it. My job is to sell those assays to researchers. So on a daily basis, I try to find which scientists are working on what are the latest publications in different areas, and I'm not limited to Alzheimer's. I look at cancer, HIV, pediatric disease, the metabolics, all areas are open. And I set up meetings with these researchers, and I go in there, tell them what it is, what products I have, and how I can help them in their research. And if I can get my products into some of the studies, most studies, clinical studies, last several years, that will be a continuous stream of income for me and for my company. So that's what I do. Does that make sense to everyone?
No.
Yes. This
So
is what I
great to
was
me.
afraid of. So when someone asks me the question, what do you do for a living? I can never give a quick answer. I could possibly say I do sales, I am in biomedical research, I work in the biotech industry. All of these are valid answers to the question. But I really don't want to spend 5 to 6 minutes or 5 to 7 minutes, which is the length of my speech, explaining to everyone what I do. So please, if you have any questions, ask them today. Let's get my profession out of the way, or forever hold your peace. Thank you.